Great. Thank you very much, Emily. Good morning, everyone, and a very warm welcome to the Eastern and Southern Africa Regional Learning Platform on Care Reform. My name is Mona Aika, and I'm a child protection specialist working for UNICEF Eastern and Southern Africa Regional Office. Maybe before we start, a quick run through of the webinar protocols for today. They were projected earlier. Just to remind everyone, those who have not done so already, to please type your name, the office, and the country that you're representing today. This is extremely important for us because we're keeping a record of all that that are attending these webinars. And I'll also like to remind all the participants to ensure that you mute your microphone during the session so that we don't have any interference when presenters are presenting. You're also encouraged to type in the chat box any questions or comments that you may have, and we'll ensure that we respond to all the questions asked. And you may also use the raise hand button that is available on Zoom if you want to ask a question directly, and then we'll give you the floor. And as Emily already mentioned, this webinar is recorded and will be shared after this session for your reference. So let me start off by giving a quick introduction of this learning platform for those who have not attended previous sessions. So the Eastern and Southern Africa Regional Learning Platform on Care it provides an opportunity for government, UNICEF, and others involved in care reform in the region to share learning on care. And the learning is shared through webinars, document exchange, a help desk, and the pairing and mentoring. The initial phase of this platform involves several virtual study tours. We've already had two and more are coming up. We also have thematic learning groups on foster care and the linkages between family strengthening and social protection. And as part of this learning platform, we will develop multiple policy papers on care reform, which will include on child protection system strengthening and the care of children on the move. This platform is open to all the 21 country offices in Eastern and Southern Africa to participate together with their government counterparts in order to share the learning. And the management of this platform is supported by a consultancy firm, Child Frontiers, and we have Emily, who was had a video on earlier, Emily Dillop, and who is the lead consultant of this work. This learning platform is for Eastern and Southern Africa region and will be led by various professionals in the region. This initiative is led by UNICEF Regional Office in partnership with Changing the Way We Care, which is a multi-country project that aims to reduce countries' reliance on residential care and support families. Just want to give a very special warm welcome to all the government representatives who are with us today, and of course to also the UNICEF social policy and UNICEF child protection colleagues who have joined us in this session today. The Social Protection and Family Strengthen Group is chaired by Micah, who is our Chief of Social Policy and Child Protection in UNICEF South Africa office. I think some of you may already remember, those who attended the first webinar, was held on the 12th of April, 2021, and it included speakers from Changing the Way We Care and the Institute of Social Protection at Sussex University in the United Kingdom. So today's webinar is on social protection and care, and will take a focus on the cash plus care model being used in South Africa. And we have 4 very seasoned speakers from government, academia, and social services. Without further ado, I would like to pass the floor to the chair of this group to take us through the agenda and introduce the speakers. Over to you, Micah.
Great. Thank you so much, Mona. Thank you, Emily, for your hard work, both of you, to making these webinars happen. This particular webinar is close to everyone's heart, and it's so wonderful to see many familiar faces this morning. So I'm extremely delighted to lead you through this webinar this morning and to introduce you to some of the models from South Africa on cash and care by this fabulous, phenomenal group of panelists, starting with government and then civil society, private sector, and academia. So this morning, I would like to ask you, Emily, to show the vision slide on the cash and care model to demonstrate the vision behind the whole webinar that we are starting this morning, then I take you through the agenda. So governments with UNICEF and other partners realized that the provision of social assistance is not enough to meet the holistic well-being of children, as not only their material needs need to be met, but also their socio-emotional cognitive needs. So in the left column, you can see in the yellow the provision of social assistance. So when pregnant mothers go to the health center, they get advice on how to register their children at birth, how to take care of themselves during pregnancy, and to register the children upon birth with the Ministry of Home Affairs. And from there, eligible families can enroll in SASA on the social grants in order to be benefiting from the child support grant. That's your left column. And then you go into the pink, recognizing that if we don't understand the well-being of children, monitor the well-being, it takes an effort then to link the children from the grants to various services and to monitor their well-being in the different domains that you can see under the first block on access to healthcare, psychosocial support, economic empowerment of the household, food security, nutrition, ECD, education, and protection from violence, abuse, and exploitation. And that is done through home visits by child and youth care workers, a family strengthening program compounded by support in safe spaces after school programs. And the whole idea therewith is to reduce the burden on the statutory child protection system and to avoid children's rights from becoming violated, as to accelerate the investment in cash and family strengthening as one of the prevention and early intervention services. So this is the vision. I'm sure you have seen it before. We have shared it earlier, but here you can see how the different blocks of the model are being interconnected. And we are going to take you through the different blocks of the model with the different partners on the platform this morning. So Emily, if we could kindly go back to the agenda. So we are starting this morning with Maureen Mcgrathy, our director from the Department of Social Development, and she will give you an introduction on the cash plus linkages strategy paper and the rationale behind such, and explain why did government decide that the 12.8 million beneficiaries on the child support grant also need to be further linked to services and complementary services like care. And then Ms. Heni Tumado is the Deputy Executive Director of the National Association of Child and Youth Care Workers, who will then take us through the role of child and youth care workers, which is so incredibly important as part of the social welfare workforce, in creating the linkages between the child grant and the services for improved care. And she will share with us some lessons learned from this process. And then we will be followed by Dr. Sonko, and she will present to us the recent findings from the National Child, the real-time monitoring tracking tool. This is a tool that some of our countries in the regions are using either as part of government or as part of NGO services. But basically, this tool is helping child and youth care workers and other social service professionals on the ground to track the well-being of children in various domains, and thereafter refer children to the various services, but to also monitor the well-being of the children real time on a dashboard. And Dr. Sonko will share with us the integrated response thereafter and the political policy implications. Then I'm very honored to introduce to you Professor Leila Patel from the University of Johannesburg, the Center for Social Development in Africa, who have conducted a very important pilot in Joburg with the municipality and city of Johannesburg on linking children in grade 1 with improved system strengthening programs through parenting programs, and the research findings will tell the story with concrete data and evidence. And after that, we will have an opportunity to chat, and we will share as a closure a nice film we made on all this work. So, without further ado, I would love to then introduce to you further Dr. Maureen Mcgrathy, Director of the Department of Social Development on Social Security from South Africa. Over to you, Maureen. Good morning.
Good morning, colleagues. I will be presenting on the policy that we are currently working on, which is integrating children's grants to social protection services. As you know, we have three main grants that speaks to children. We have the child support grant, we have the care dependency grant, and we have the foster child grant. You may move to the next slide, please. Yes, and in our presentation, I will just give you a background and the challenges that led us to work on this particular policy proposal and what we are currently considering. Can we move? As I said, we have three main grants that we give to children. The child support grant, which is the grant that is the biggest grant or social assistance program in the country, but we also have other two grants that we give to children, which is the foster child grant, as well as the care dependency grant. So this particular proposal speaks to integrating these three grants with other social protection programs that we have in the country. Can we move? As I said, we are in the process of developing this particular policy. The policy, we've been working on this for the past 5 years. We started with conducting a number of studies because we normally do not just develop a policy. We firstly conduct studies to understand the need and the challenges that are there. And this was followed by the proposal. So we are at the stage where we have a draft proposal and we are consulting on that proposal. We are saying that social assistance or income support is only a part requirement for holistic development. It is not a silver bullet. As government, we provide social grants, but social grants on their own do not meet the needs of all of our children. So it is very critical for us to link our children with other protection services that we have. So this particular proposal basically talks to the interface of existing policies, institutional structures, and systems in relation to child protection programs, as well as aligning them with information system, because you cannot do this without aligning different government information systems. Can we move? Just to assist, when I move towards the end, you can move because I'll be speaking to some of the points. As I said earlier, we have a number of social assistance programs. When we started with a social grant program, which was only meeting a particular number of children. And you know, all of us, that the social grants are not, especially the child support grant, the amount is a little bit smaller and it cannot meet the needs of all children. So it is necessary for us to meet the needs of, or to link this grant with other programs. And in 2003, when I looked at our records, in fact, in 2003, Cabinet directed us to link grants to services, But because at that time we were still building the program, we were not able to do it at that time. So we are at the view that this is the exact time that we need to link our grants to services. If you remember, in 2010, a decision was taken in the country to extend the child support grant by attaching a soft conditionality of school enrollment and attendance. That was the introduction, basically, of linking. But because we really do not have a policy, we have not really been able to implement the soft conditionality as we should. Can we move? And when you look at our NDP, the NDP recognizes the value of integration. So this particular policy falls under the strategy that we have in the country, the NDP strategy that really talks to linking all of our services. So we are upholding the rights-based approach upon which the South African social protection model is built. Can we move? I'm having a problem with alignment of the presentation. Can you move it to the other side?
Sorry, Maureen, what did you want me to do? Is that the right slide, the purpose one?
It is the right side, but it is bigger than, I'm not sure whether other people are able, but from my side, it is bigger than what it should, but I can proceed. Yes, thank you so much.
Okay, let me see if I can play with the screen size and see if that helps. Is it
okay?
So you're not.
But I'll continue.
Yes, you continue. Apologies for that. I don't know what the problem is. I'll try and sort it out though.
Thank you so much. What is the purpose of this particular policy? The purpose of this particular policy is to support investment decision across multiple players. As you know, in the country, social protection is rendered in different departments. It's not only in social development. In social development, we render ECD, we render social grants, but basic education, which is outside our department, renders education. Health is rendered by Department of Health. So the purpose of this particular policy is to integrate these particular programs across multiple areas. Social grants are key because we have the biggest number of our beneficiaries. We have about 18 million beneficiaries. So it is key that we start with what we have. How? We are going to do it through aligning information systems. You cannot do this without align or linking with data management systems. And we have rooted this in economic evaluation and institutional analysis, because through this, you will be also saving a lot of funds. Can we move?
Sorry, I'm trying.
It's much better. Maybe we should use this format rather than the full screen.
Yeah, apologies. It's just not allowing me to move on if I use the other format.
Okay, what is the rationale for this particular policy? The rationale is basically that poverty and vulnerability are multidimensional, are not a manifest of not only income deprivation in the country, but include dimensions as health, nutrition, education, sanitation, etc. So you cannot address poverty and vulnerability through social grants only. It is very important that you link your children or you link your beneficiaries to services that are rendered by government. The potential for more enhanced and sustainable socio-economic and developmental impact, as well as breaking the intergenerational transmission of poverty. This is our view, that as we integrate or as we link, we will be at a better position to address intergenerational poverty. Can we move? As you see in the country, fine. Can you go to the slide which has the, yes, thank you. As you see in the country, currently our programs are not really aligned, are fragmented. We have different policies rendered by different governments. So what we are trying to do is to ensure that these programs are linked so that we have greater impact at the receiving end. So if you link your programs, for example, currently we are attempting to link our social grants with NSFAS by ensuring that children receiving grants are linked with NSFAS, meaning that those children will be able to attend postgraduate studies, and it is easy for them to access postgraduate studies, unlike before, where they will have to apply like any other child. With this particular program, when we link it, we make access easier. Our children are able to access other services like NSFAS or immunization. That is the intention at the end, that none of our children should not find themselves not receiving any service rendered by government. Can we move? This approach really seeks to move us from working from a silo approach or a fragmented approach to working together as government. It means developing a comprehensive social protection strategy rather than a piecemeal initiative, because currently we are working as various departments with various mandates, but our mandates are not really linked. So as we proceed with this particular approach, we will ensure that all of our programs are linked. So we'll ensure that our children are linked from birth to other social services, especially with 3 important services that we render, which is ECD, health, as well as basic education. What is the biggest enabler? The biggest enabler is an integrated data collection. We cannot do this without linking our systems, and also cross-sectoral collaboration, different departments working together. Can we move? What are the objectives and the intention to formally link children grant with services to strengthen the impact of children's grants on our child household well-being, as well as sustainable development, to improve indicators such as education, healthcare, and so on. South Africa's social security system functions from a constitutionally enshrined right-based approach, which importantly influences the identification of a linking pathway. Can we move? As you see in this model here, we are trying to move from a scenario where we have every department rendering its services. As you see there, we have a number of services. We have cash transfer, which are social grants. We have ECD, we have NSFAS, school scholarships, and so on. So if we render these services individually, we are going to get individual impact. But if we decide to link our system, we are going to get a combined impact rather than individual impact. So you will have a combined impact of poverty reduction, food security, human capital development, social inclusion, and so on. So that is basically, it basically outlines what we want to do as government. Systems integration and benefits. There has been a global move towards single registries. We are not the first country that is doing this. When you look at other countries, we have seen other countries moving towards single registries, and the benefits are multiple, including coordination, harmonizing our social protection instruments, enabling profiling, reducing linkage, reducing or eliminating double dipping, ensure that the right people receive the right services, and also improving access to the services. We can move. So what are we looking at as government currently? We will be starting, although the intention is to link all services, but we need to start from somewhere. So what we are proposing is to link 4 main services that we have, which is early childhood development, education, healthcare, as well as psychosocial support. So our intention is to link all these main programs with social protection. We will start internally. Even internally as DSD, our programs are not necessarily linked. Our social grants are not necessarily linked with social welfare programs. So we will be starting internally by ensuring that our grants are linked with ECD and other social protection programs such as psychosocial support and so on. And after doing that, we will then extend to other departments like basic education, Department of Health, and so on. It is very critical to mention that we cannot do this without the Department of Home Affairs, because the Home Affairs controls our registry. So in doing this, we will do liaising closely with Department of Home Affairs. Can we move? Next slide, please. Where are we currently? As I've said, adopting an integrated approach means developing a comprehensive social protection strategy rather than a piecemeal or a fragmented approach. What we did, we have currently compiled a draft policy on integration. We have costed that a draft policy. We will be consulting on the policy in this current financial year with the intention of going to Cabinet to introduce this policy in the next financial year. Currently, we are having protocols with other departments. We will continue working on those protocols and extending or expanding the protocols to include other relevant departments whilst we are waiting for the finalization of this particular policy or adoption of this particular policy. We have an interdepartmental tasking form where we work together to share our programs and way forward in terms of how are we going to take this process forward. As I said, in this current financial year, we will be consulting on the policy both internally and externally. Can we move? Policies are developed to make provision for the rendering of services in order to meet the needs of people. As I said, we have different policies that meet the needs of people, but our assessment clearly shows that we can meet or we can reach out to children greatly if we coordinate better. So global lessons of an experience demonstrate that comprehensive and integrated responses can increase the impact of our services. I always say social grant, the child support grant, is not a silver bullet. It cannot work on its own. Yes, we started with the grants because it was at that time, there was a need for income support. Now that we have reached out to all of our children, it is critical that we ensure that our children access the right services at the right time. So this policy proposal promises a multidimensional approach to improve integrated service delivery mechanism that strengthen a life cycle approach by integrating cash transfers or social grants, and in this case, children's grants, the child support grant, the care dependency grant, and the foster child grant to effective and developmental services. We are intending to consult, so we'll be coming out this year, consulting with various NGOs, consulting with various departments on this particular policy. And after getting the mandate, we will then attempt to take this particular policy to Cabinet. Thank you, colleagues.
Thank you so much, Dr. Mcgrathy, for this very comprehensive presentation. that also demonstrates the journey that South Africa has gone through. So South Africa has the oldest and the largest child support grant on this continent, which started to develop, as soon as democracies began, and in 1998, the whole journey of the child grant has evolved ever since to reach 12.8 million children with social assistance. The rationale has been clearly explained from why do we need to further link the child grant beneficiaries to services and to complementary care and support the rights of the child throughout the life cycle, the interlinkages between various government departments, and the whole policy process from strategy development to policy development. So at the end of the presentations, there will be a time to ask questions to the different panelists. So without any ado, I would like to thank Maureen once again for your very comprehensive presentation. All presentations will be shared with all participants. And I would like now to request Zeni Tombado, the Deputy Director of the National Association of Child and Youth Care Workers, to provide us with the clarity on the role of child and youth care workers as part of the social welfare workforce, and how through living and working in the life space of the poorest and most marginalized children, this vital workforce does create the linkages to services for child grant beneficiaries. Over to you, Zeni. Thank you.
Thank you. I just get my... Thank you very much, and thank you for giving me the opportunity to present on the role of child and youth care workers in cash plus care. Just to start off by defining child and youth care work, what is child and youth care work? Child and youth care work is direct work with children and youth in the context of their families and communities. Child and youth care work promotes the social competence and the healthy development of children and youth by participating in and using their everyday environments and life experiences, and through the use of developmental and therapeutic relationships. We often say that child and youth care work is relational work. Child and youth care workers engage with children, youth, and families and communities in collaborative and respectful ways. They take practical action. Child and youth care workers are very direct, hands-on practitioners in order to create conditions for young people to experience meaning, to experience worth and connection, and supporting them to imagine hopeful futures for themselves. And child and youth care workers bring themselves fully into the therapeutic experience and relationships. We talk about being present in the lives of children and families. And these are the hallmark characteristics of child and youth care practice. The three central concepts of child and youth care work that might be helpful to describe now is, as I said before, child and youth care work is relational practice. And according to Kruger, relational work is a way of being with children and youth in their life experience, bringing ourselves as child and youth care workers into the moment in order to create as many moments of connection, of discovery, and of empowerment for both ourselves with each other. Life space work is another central concept for child and youth care work. It is a defining concept. Child and youth care, life space work is a way of conceptualizing of work with young people and their families in spaces where and as their lives unfold. We often talk about working in the physical life space of children, but we also talk about working in the emotional life space of children, in the social life space of children, in the intellectual life space of children. And more recently, within COVID times, we found child and youth care workers working very effectively in the virtual life spaces of children, where they engage with them in social media and other ways that young people connect with each other. The third defining a concept in child and youth care is the effective use of developmental and therapeutic use of the daily life events. And just to clarify this with the quotation from an Bindi child and youth care worker, she talks about being with them. And then when he's washing his socks, for example, the child, as a child and youth care worker, you must also wash with the child. So you're engaging with that activity with that child. And at that time, we were talking, what was your day like? What were you doing at school today? Are there any challenges you experienced? Are you happy at school? And then the child is free to talk to you. I think what we're saying here is that in engaging with children developmentally and therapeutically through ordinary daily life events, what we are able to do is connect with children. And there are many disclosures about sexual abuse and other issues affecting children that come during these ordinary interactions. Just some quick pictures here. You can see a child and youth care worker working with the child who's cooking, teaching him how to cook, washing socks and school uniforms with the children in the second picture, and of course reading with them. It's an educational program, but at the same time, it's social engagement and teaching. Child and youth care work is a regulated workforce, and they have a scope of practice. Child and youth care workers function both at auxiliary level, which is your paraprofessional worker, but also at the professional level with their degrees in childcare. The scope of practice includes the basic and developmental care of children, behavior management of children, both proactive behavior management and active behavior management, designing and implementing programs and activities, supporting developmental assessments of children. We don't do clinical assessments of children. We refer for clinical assessments after a developmental assessment has been undertaken. We create planned environments for children for routine and predictability in their lives. We engage in administration and, importantly, multidisciplinary work, working with social workers, psychologists, educators, and other people on the multidisciplinary team, as well as, of course, advocating for children on children's rights. The practice settings for child and youth care work have traditionally in South Africa been residential care, children's homes, places of safety, and secure care, places for children in trouble with the law. More recently in educational environments, schools, but also opening for farm hostels and other places where children in education reside, and of course in communities, in South African communities. So some of the challenges in providing for the care in communities and families in the context of poverty. And I suppose this is well known to everybody on this webinar, but I'd like to express it that an intergenerational accumulation of shortages is how one can describe the holistic poverty experienced by families in South Africa. From a community point of view, you're dealing with poor infrastructure, including the lack of access to piped water and electricity, difficult roads, if there are roads at all, difficulty with transport, no parks for children, long distances to schools and clinics and resources and shops, and presence of taverns and other places in communities. In families, we're actually seeing unemployment, lack of income, food insecurity, chronic health problems, violence, including gender-based violence, absent fathers, and patriarchy. And children are experiencing hunger, stunted growth, which is a big concern, I think, at the moment for us in South Africa. No early childhood development programs and facilities, not enough, if there are them. No play areas, long distances to walk to school, and of course abuses that children experience, emotional, physical, but the issue of sexual abuse and rape being a real concern. So violence, patriarchy, abuses, drug and alcohol abuse, gang activity, teenage pregnancy, child and youth-headed households are all the issues that impact on children in the context of their families and communities. I just want to conclude the slide by saying that families with multiple problems live in communities with multiple challenges, requiring a multi-pronged approach, including a compact with the state for support. So a quick introduction to the Bindi model, which is more than a 22-year-old model that was developed, piloted, and contributed to the development and showcasing of child and youth care workers and communities in South Africa. Bindi is, by the way, an isiZulu word meaning courage. Bindi at its heart is a home visiting program demonstrating the role of childcare workers who have supervisors and mentors guiding them, but home visiting, the home visiting program, with the purpose of family strengthening in the life space of the child. So when child and youth care workers visit families, they develop family plans, they develop individual development plans for each child in the family, recognizing that each child is unique. They engage in family case conferencing, including social workers, health professional educators, child and youth care workers, the child and the family. And where necessary, they've developed special ways and unique specialized programs. For example, all children are attached, if possible, to a safe park, where there's a safe place for children to play, and they play with community children, where we found that there was a need for early childhood education. The non-center-based ECD program was developed. A child protection program for sexually abused children was also developed, because there was absence of therapeutic and clinical support for children in rural areas, a program for children with disability, and of course, a youth development program. These are specialized programs that added on to the home visiting program. But most importantly as well, child and youth care workers connected and referred children. So we've referred children to Home Affairs for ID documents and birth certificates, to SASSA for social grant, education, for example, admissions at schools and free exemptions, nutritional programs and food parcels and food gardening, seeds for food gardening. With health, we've referred to HIV counseling and testing, and now with COVID, we're responding to the COVID vaccine rollout in South Africa and the security there, and to social workers, for example, with child abuse and case consultation. But ultimately, all these activities of the childcare workers is aimed towards increased family resilience, which means that we were looking at outcomes that were improved school attendance and performance from our children, improved healthcare and status of children, improved nutrition, improved economic situation, and of course, reduced abuse. So it was a family strengthening approach, and Bindi is a family strengthening approach, a model with that approach, which works with the child in the context of the family and community. It's a child-centered, family-focused, and community-based program, recognizing that family problems are diverse and systemic and layered. And of course, in that regard, intergenerational. And that family diversity requires programmatic interventions that are contextualized and are custom designed responses to each family and to each child. And for this, we realize that a localized workforce is very relevant. And I think that the potential effectiveness of home-based, flexible, integrated, and multi-component services has been cited in international literature. And the Bindi model was a demonstration of the South Africa version of a response. Here's a quotation just from a young child saying that the childcare worker visited my family without being referred by anyone because she lives in my community. The childcare worker started visiting my family after I lost my father. The childcare worker knew about our father's death and knew that we would benefit from being part of the Bindi program. She realized that Bindi could help us deal with grieving and further assistance. It is from this background that I became part of the Bindi program. The childcare worker identified the needs in my family and then intervened. The childcare worker supported my family with the grieving process, and then the childcare worker is currently assisting me with my homework, and I'm doing better at school than before. And I'm certain that I'm going to pass my matric, which is a final year in high school, since I'm working hard and being supported by a child and youth care worker. And that's a quotation from a youth beneficiary. But honing into the purpose again of this webinar is to look at the role of child and youth care workers in cash plus care, and what are the lessons we learned as child and youth care workers in accessing social grants and social security grants. I think the first one is that understanding that the first step in actually accessing a social security grant is getting your documents. And there are serious challenges, particularly in rural areas, sometimes in accessing basic documents. In many rural communities, people bury family members in the community. And that basically means that there are no death certificates in place. Sometimes children are born and there are no birth documents. Sometimes fathers live in cities and cannot be accessed for documents. And in this regard, child and youth care workers were able to go to traditional leaders and to go to church organizations for baptism certificates and help the families access documents in order to make an application for an official identity document that would again allow them to apply for a grant. And of course, in all of these processes are bureaucracy and red tape, which families struggle sometimes to deal with. And the child and youth care practice addressed the unjust policies and practices that are often described as so often indiscernible because they are so embedded in the fabric of society. And quite often families would say that I'm not prepared to go and stand in a long queue anymore. I'm not prepared to actually go and sit again and ask for the same thing to be rejected. And I think that often resulted in people not accessing their rights, which were for the grants. And then we dealt with quite often inefficient and officious government officials, sometimes social institutions that are created to help and support families actually humiliate those it aims to protect. I think that in communities we found that people are scared of government officials and scared to go and make the applications for grants and for documents. And also we've learned that it's important then in this regard to build localized stakeholder relationships. And they know the police, they know the indunas, they know the chief, and they know the councillors. They encourage these stakeholders and others to work better, to work with, I think, more compassion towards those that they're servicing. Child and youth care workers also understand processes and procedures, and they say that sometimes families don't even know where to start. And we have to teach families the steps that they don't know. They might not know that you need to have a document before you apply for a grant. And once you apply for a grant, you have to wait while the processes take place. And these are the little steps that are important for families and to understand. And generally, child and youth care workers provided efficient, paced, and layered interventions. In terms of, again, planning for the use of the grant, because even if you've applied for a grant, you've got to wait for that grant to come. What happens in the meanwhile? I think that here, child and youth care workers have supported families, and they've adapted their support for diverse family structures. Child and youth care workers have worked with granny-headed, we call them gogo-headed households, with youth-headed households, with single mother families, and with child-headed households. We've provided them with interim support by networking resources to families while they're waiting for grants. Quite often in communities, you have loan sharks, people who loan you money knowing that you're going to get a grant, so you build up a debt. Child and youth care workers were to support families to not get trapped into deals with loan sharks. They helped access food parcels from government, but also from church organizations and NGOs to support families in this time when there was no income at home, and also waiving school fees, ensuring that children go to school without paying school fees and access the feeding scheme at schools, which we have in South Africa. Also, they assist with budget planning, and this is very important because childcare workers set up family meetings, which might not have happened before in families, with child participation, ensuring that children participated in family meetings and could also raise issues that were important for them in discussions about budgeting. And because when sometimes in South Africa, the grants come in, there's a back pay You might have applied in January, you get it in June, there's 6 months of back pay, which is a large amount of money that might come into the family. We can predict that, and child and youth care workers would actually look at how would you use that money when it comes? What would be a big thing that you might want to use it for? And to allow for some immediate gratification so that the family can see the impact that a grant can have in their lives. But at the same time, they would teach them about saving and how even with a grant, and as little as it is, you can still save a little to delay gratification and work to things that you might actually need to save for. So there's the ongoing monitoring and use of the grant. This is after then the grant has arrived and the family has received their grant. And one is a protection of the Social Security grant. Here's a quotation. If there's someone in the family who abuses the grant money of the child, we sort it out. We involve the social workers and help them understand that the family cannot do that. We teach them that the money is for the child, for good things for the child, not, for example, for alcohol. Because in families where there is alcohol abuse, quite often the grant might be utilized for drugs or alcohol. Also, the child and youth care workers would continue monitoring adherence to budgeting and to see that the issue of budgeting is entrenched in family work and family planning. And of course, with regular family meetings that they would hold, where we, as a quotation says, we have a book so that every month we sit down with them and we teach them how to budget. I teach them to support them for maybe 3 months to see that they understand how to budget. Then I make follow-up visits to see if they understood it and if the budgeting is being done. And then we take it from there. You see, if they get the grant money without understanding budgeting, the money will not really help them. So child and youth care workers maintain in these family meetings, child participation, ensuring that children's needs are met in the context of family needs. And then in continuing, they monitor savings plan. As we say, I taught them to make a memory box and to budget. They were able to budget, and they were able then to build a 3-roomed house now. They are no more staying in a shack. And we've seen this kind of impact with the use of the grant, where we found that families have made very significant changes to their accommodation. Also, the promotion and support of small-scale entrepreneurship, little things like selling sweets to children who are going to school, or chips, or having poultry farming, getting a couple of chickens so you have eggs, and or food gardening. Small things have the grant has been used for to support the family. Obviously, child and youth care workers access other resources to supplement the grant. If the NGO or the government are offering free sanitary towels for children or free other issues, we make sure that these are access to the family so that their grant can be used for other needs. But I think importantly as well is it's all about childcare workers creating hope as well. It's celebrating successes together. When you've built another room on your shack, it's worthwhile to have a little celebration as a family, to be grateful for what you've received and how you've managed it. And often child and youth care workers participate in family celebrations. Sometimes there are rituals that are done to celebrate achievements. And then, of course, intervening when something goes wrong. Child and youth care workers will assist if a grant is stopped. We must go to a social worker to know why the grant has been stopped. So the social worker then was able to assist us, and that sometimes happens as well. So just to conclude, I just want to say that child and youth care workers connect with children and build relationships with them through the use of daily life events. They help families with basic household chores. They educate them about hygiene, about gardening, about health, about nutrition, and about household care. They cook together with the children. They teach them basic life skills, and they build resilience. They use ordinary human interaction as a context and a means for transcending basic care to meet the emotional needs of children and of families. This came from the Larissa Award that was won by the Bindi project in 2012. The services provided through Bindi do make a real difference in the lives of those orphaned and vulnerable children who receive them, and may well have a multiplier effect within the household and across communities more generally. This is from a midterm review funded by UNICEF that was done in 2016. And then a last quotation from a piece of research on Bindi is that childcare workers are considered assets in communities, bridging the divide between community members and government services, both by linking children and youth to critical services, but also by communicating the needs and challenges of community to government. And this was a KPMG report, 2015-16. Thank you very much.
Thank you very much, Zaini. Oh my God, you know, the role of child and youth care workers always warms everybody's heart. It's such an incredible, important work. And they are playing such a meaningful role in the lives of the poorest and most marginalized children to help these children get the connection they need, both emotionally as well as to complementary services and protection. So thank you so much, not only for this wonderful presentation, but also for the hard work that NACCW has been doing for the last 24 years in developing this model with the workforce. So as to gain time, we will move to the next presenter. Please, Zaini and Maureen, look in the chat. There are many questions coming through for both of you already. Dr. Sonko is waiting to present to us the findings from the use of the real-time monitoring tracking tool that has been used by government and stakeholders to track the well-being of children as a result of COVID and lockdown in order to gauge how they are faring. Rita, we look forward to hearing from you. Over to you.
Thank you so much, Mikey, and thanks for the opportunity. I'll just try and make it quick. I know that time is tight. Gosh. All right. Moving the slides is becoming an issue right now.
I can do that for you, Rita. Yeah. I'll just move on to the next one. Is that what you needed? That one?
Yeah. Oh yeah, you shared now as well.
Yeah. Okay. Is that? Did you want to share your screen?
No,
you can do that. Whichever you prefer.
Yeah. So the presentation will just basically touch on an overview of the Rtmt, the tool itself, and then I'll talk about the rapid assessments, and I'll talk about how this is transforming DSD's response. On the next slide, gives us a bit of a background on the Rtmt. We started this work in 2019 with DSD and UNICEF, and initially, it was really to support testing of an integrated technology that enables the gathering and analysis for care and protection of vulnerable children and families. Once we had developed that tool and were ready to basically start piloting it, unfortunately, COVID came about and we were not able to do that. But then as things rolled along, we then worked with DSD and UNICEF to work on this rapid assessment of key monitoring indicators, measuring the impact of COVID-19 lockdown on child well-being in South Africa. So this rapid assessment has actually given a great opportunity to test the Rtmt across the country in multiple situations, and in fact in 18 districts. That's where it will be actually rolled out in the initial phase. And we launched this in December 2020 and have so far collected data from 6 provinces and 12 districts. And it has really demonstrated the potential to strengthen efforts of DSD, the NPOs that Zaini was describing, the stakeholders that work to provide more effective services to children. So I'm going to talk about the Rtmt briefly. On this slide, you can see just a bit of an overview. This is a multi-platform mobile application that enables the production of real-time data and includes data management and visualization capabilities. So we're looking at all these domains, as you can see demonstrated in the image. And we capture data including child demographics, their well-being status on those domains. And then we create a care plan. A care plan can be created on the application by the child and youth care worker or whoever is implementing this in a household setting. And then we have also included gathering data on disabilities so that it enables early screening and referrals to specialized services. On the next slide, you can see, pretty much I've talked about this, but I wanted to mention the COVID prevention information, knowledge, attitudes, and practices at a household level pertaining to COVID were also included in the survey that we did for the rapid assessment. On the next slide, I described just very briefly what the tool looks like. So at the, you start off with social service practitioners who have a mobile device going to do these home visits, very similar to what Zeni was describing. During the home visit, they would then basically undertake the assessment with the children and their families. And following that, they then create this joint action plan that is created by the social service practitioner and the caregivers while still in the home. And then these findings that have emerged from this assessment are then uploaded online and they become available to all the different stakeholders that need to use them. So that is the vision. At the moment, we are able to produce dashboards that service office managers are using, the NPO managers can access as well, and DSD district managers are able to see what's emerging from there. So this information then should trigger interventions to these families with a response, hopefully an integrated response by the different actors that need to support the family. On the next slide. This is just a picture from one of the rural areas where we did this work in Hari Gwara district, very, very remote, but because we are using an offline capability onto the app, one is able to actually capture data even in these very rural settings. I'll just quickly highlight some of the findings from the rapid assessment. So the rapid assessment aimed to basically achieve these two main objectives: to determine the immediate impacts resulting from government's response to COVID-19 and to identify and provide support to those at high risk of hunger, violence, abuse, and neglect. On the next slide, the approach for data collection was dual purpose. Firstly, to gather scientifically sound data for decision making, while also providing a mechanism through which DSD can respond to the immediate needs of children and families that are identified during the study. So in order to achieve these objectives, our research team was paired with DSD-funded field staff from NPOs at a ward level. Some of them are directly employed by DSD itself. And these people went together with our research team into the household. So it would be a pair of them that would go into a household and basically engage, conduct the assessments, and basically provide the support that the child and youth care workers or community caregivers were able to provide during the home visit itself. On the next slide, this is a dashboard that comes from the data that we have collected. So up to this point, when we had actually completed the data collection end of March, we had reached just under 3,500 children in 2,000 households from 6 provinces, as I indicated, and 12 districts. And you can see that as the number of children that have been reached in the different places. But I think most important and of interest to this team that is on this call is the findings around what did we actually find. You can see the red, if you can just go back to that slide. The red is emergency situation that we found. The orange is high risk, medium risk is yellow, and low risk. But you can see that access to health was a big issue. There's a lot of risks pertaining to health. There's a lot of risks pertaining to food security, care and protection issues, big problems there, but you can see education as well. And of course, we're still doing the analysis, and we'll be able to report back on the actual research findings, but this just gives you a bit of a highlight. On the next slide, there's some data that we present here, percentage of children accessing social grants. You can see that from our sample, pretty much 90% on average were accessing, children accessing social grants. So the aim of the project was to go find children who are accessing social grants, children who are highly vulnerable, and then assess the well-being according to those different domains. On the next slide, experience of hunger. I think Zeni mentioned this, but you can see the difference, again, the cascade, with some districts highly vulnerable. 50% of children in John Tawolo district, this is a district in Northern Cape province, down to, a 3%, but, the high levels of hunger, experience of hunger among children in many of the districts. And of course, that will result likely in other issues down the road. On the next slide. Percentage of children reported feeling worried. So here now we're dealing with the psychosocial issues, and you can see again varying differences in this particular indicator with Mangaung. Mangaung is Free State. In Free State, a lot of issues going on there, and this is something that we are trying to dig deeper into the data to analyze and see what are the other correlating data that we are finding as we analyze. You can see also Cape Winelands, again, high numbers, and Harigwara as well. On the next slide. This is percentage of children feeling suicidal. You can see 8% in city of Cape Town, and Cape Wineland 7%, and Mangaung, again, the same districts coming through with this suicidality among children, and of course, really alarming and something that requires really urgent assistance. On the next slide. Sexual abuse, you can see again, very alarming results from some of the sites, 12% in Cape Winelands. And so some of the analysis we're doing is also to correlate what is this correlating to across the different data sets. So we'll be able to report on that once the analysis is done. But this data immediately became available to people to be able to start looking at a response by identifying those particular households where the red flags were found, and making sure that something was being done to protect those children. On the next slide. All right, so how did the Rtmt transform DSD's response? We have some observations and feedback from the field, and there's been high levels of interest by field workers in using this technology to produce real-time data. As I said before, the offline mode allowed for easy access without connectivity challenges during field work, even in the most remote areas. And people were really engaged and interested in learning. The data visualizations that are produced on the app made it easy for field workers to access key findings immediately while still in the household, and be able to then say, okay, what are the red flags emerging for this particular household, for the children in this household, what are we going to do about it? So the action plan that would then be discussed at that point enabled that immediate response to start to be created immediately, even phone calls to be made to people who could assist immediately. Service office managers came on board and became really engaged in addressing the emergency needs that they found with children and families. I think as Zeni was presenting, she did mention around the bureaucracy and issues around delay in response. And what we have found with service office managers really being engaged and plugged in, social workers being waiting to hear what's happened on the day and getting these dashboards as well, really enabled that faster response in addressing the needs of the most vulnerable children. On the next slide, we found that it also provided an opportunity for coordination and integration of service delivery by field workers from different departments. So community health workers from Department of Health, working with community caregivers or child and youth care workers supported by DSD. They work together to solve problems. So in the picture, these three ladies, one of them is a research officer from strategic analytics, but the other two are actually from a Department of Health and Department of Social Development, going to the household, working together to try and figure out how to help this particular family. And that, when we had the feedback sessions with them, they expressed the interest in continuing to work like that in an integrated way. And this beginning to really showcase some of what Dr. Maureen was talking about in terms of integrated service delivery and a coordinated response. Service officers and district managers have found the dashboards extremely useful in providing insights into the state of well-being of children. This has triggered a much faster response as well. So social workers and managers really getting up and really doing everything they can to support the families. On the next slide, I have a few quotes here from people that we were talking to and following up and checking what's going on. And you can see a field worker. This field worker actually works for an NGO in Cape Winelands. And he's saying that the red flags have really triggered an immediate response. People have been assisted. He gave examples where there was a child who had attempted suicide, that someone, really came on board, the social worker came on board, and that this system is really great for the future. We and social workers need to use this permanently as we can to respond quicker to the needs of children and families. A quote from a social worker in Amatole district in Eastern Cape talks about the fact that people got to know about services that were available that they didn't know about, and that there was immediate response again as things were being picked up in those households. People are asking that they go back to provide services because now they know that government can actually deliver certain services that they were not aware of. And then, of course, as they picked up issues, they were able to respond. She does say that because of the information that they collected, many people got assisted with foster care support. This foster care grant is something that is still very low compared to where it should be, because a lot of people don't know about it. They know about the child support grant. They don't know about the foster care grant, which is also significantly more money. But also the process is more difficult to work through. So by getting people working together, getting social workers involved, even in the most remote areas, there was opportunity for people to engage in that area and get that support. From a CCG in supervisor in Ngugundlovo, I thought this actually really touched me, I must say, from this person saying that I don't feel ashamed anymore because I can now pass their house knowing that they got a food parcel yesterday. They'd been waiting for a long time, and because of this particular engagement, and with the support of a social worker coming on board and seeing the situation, they were able to fast track the food vouchers from DSD and help these families that hadn't had food for a while. And this was in February when we had feedback session, and they had been struggling to help a family. And when we did this work in that area in February, there was that much more engagement and support from the social workers to really resolve the problems and getting these families food parcels. And then the last one, again, just reflecting the need for the real-time data in facilitating service delivery and getting the provinces to act on the findings. On the next slide. All right, so what's happened since there's been a lot of engagements to plan and support institutionalization of the real-time monitoring tool into DSD systems. There have been extensive engagements with different stakeholders within DSD to look at how can they improve the information management systems and build this RTMT within that. So we had a number of presentations to different forums of DSD, the IMST, so this is Integrated Management Systems Technology Forum, the Integrated Justice System Leadership. This is a multi-sector program led by the Department of Justice that is really looking at child protection and the response. And they're looking at the data that is coming out of the RTMT as extremely useful to give them insights into how to connect with the police department, the SAPs, the correctional services, the NPO, that National Prosecution, the NPO, the NPA, the National Prosecution as entity, and all the different stakeholders that are required to respond to the issues of child protection. So these discussions are happening, and in March we had the opportunity to visit with the chief information officers from the different departments, different provinces, together with national DSD, for them to experience the RTMT at a household level and see how it works with communities, with child and youth care workers, and see how they can actually improve the use of this technology and access to real-time data in order to improve service delivery. So these ongoing discussions will hopefully result in a scale-up of this technology. And we're very excited about seeing how already it's making a difference where it has been utilized and the demand is very high. I wanted to say just in closing that we are working now on the next phase, which is really to improve the disability tool. We found that with the data that we are getting, a lot of children who are sick were reported as having a disability because they were not able to walk at the time, maybe 2 weeks before when we collected the data, they had been unwell. As you could see, there's a correlation between ill health as well and disability data that we're finding. So we are doing some improvements on tool, and we expect to be able to go back to the field, collect more data, and be able to write up and share the reports that emerge from this. Thanks very much for the opportunity.
Thank you so much, Dr. Sonko, for this very comprehensive presentation that demonstrates how the use of a real-time monitoring tracking tool leads to an integrated response by various teams of social and health workers to go back to these households and meet the children's needs with social assistance, food vouchers, and access to services. And also how real-time data in this instrument have led to triggering a political and policy commitment to integrate such instruments to make the work more effective on the ground in terms of data collection and follow-up. So very excited to see these developments, a lot of nuggets from the last 3 presentations. There's a lot of important information coming to us. Dear panelists, kindly respond to the questions that are arising in the chat. And I'm very honored to further introduce to you Professor Patel. She has been working in government herself for a long time and is now heading up the Center for Social Development of Africa at the University of Johannesburg. And from Professor Patel, we will be learning more on cash and family strengthening through a concrete pilot project that was done and the research findings. And there are further questions from the region on if we had to choose on 1 or 2 components of the model, what should we be investing in? And it's definitely, you know, monitoring the well-being of children and accelerating the investment in family strengthening programs. Professor Patel, over to you. Thank you.
Good morning, everyone, again. Can you hear me? I think I have unmuted myself. So thank you, Micah, and thank you to the speakers. I think that was so informative. Everybody's working in the same space in South Africa, but we seldom have this opportunity to speak together. So, so I certainly learned a lot about the kind of connections between all these various efforts. So the piece of work that I've been involved with, and let me try and see if I can share, my screen with you. I'm not very good at this, and if I'm not managing, then I will ask Emily to help. Is that with you now? I hope I can start it from the beginning.
Yes, we can see it. Thank you so much.
Okay. Thank you. So this piece of work started a long time ago, connecting cash and care for better child well-being. What I'm going to present is an empirically validated family and community strengthening program for beneficiaries of the Child Support Grant. So as I alluded to this, we started this work about 7 years ago. And I, of course, want to acknowledge our team members who are listed on the slide, including different funders and organizations and partners that we've worked with to develop this work. At the early stages when we started this work, the idea of cash and care was perhaps not that well established, and we then built on this work over time. And I'm so pleased to see the work in the department growing at the pace that it has. So that's certainly a lot of progress. Let me then just move very quickly to the actual question that we try to answer. So the question that we asked was, how could we build on the already positive benefits that the Child Support Grant produced, and that we saw in a lot of the different data sets over in the late in the 2000s and the latter part of the 2000s. We saw the benefits, and we asked then, how could we build on this and step up child well-being outcomes? And it was this research question, that got us to where we are with this research project. And I won't go into the rationale for it. I think it was well set out by Maureen earlier on, and then picked up by each of the other speakers, including Micah and the model. But initially we got funding from the Pro-Poor program for Pro-Poor growth, which was through the presidency and funded by the European Union. And it was a very data-driven piece of work to look at what were the challenges experienced by children. And we don't have a specially designed data set that would help us monitor the well-being of children. So we used one that had quite a bit of anthropometric and other measurements. And through that we then designed and developed an intervention solution, which was titled named the Sihlengimizi Family Strengthening Program. And then we worked on validating this. So there was a pilot initially, but then this was followed up with advanced development, testing and evaluation and implementation through the City of Johannesburg. And I've shared with you the peer-reviewed journal article on which is based, and including the presentation. So what we wanted to do, our hypothesis was basically, in our theory of change, was that the combination of cash and care interventions in 5 domains will empower families with knowledge, skills, and social support, and that this in turn would improve child, caregiver, and family well-being outcomes. We assume that in the long-term interventions that tackle the structural barriers that poor families face could break the intergenerational cycle of poverty, inequality, and social disadvantage. And so we designed the program for Child Support Grant beneficiaries in the age group 6 to 8 years, that is in grade 1, R and grade 1. And the program was then adapted also from the Safe Children program, which was developed at the University of Chicago, and where I had a stint as a research fellow and visiting scholar. The Xislenkimizi program briefly has is offered twice. It's a 2-hour week group intervention with the whole family. It runs for 14 weeks, and we have about 3 to 5 families in each group. It includes children of different ages, including fathers and caregivers and other family members who are involved in the care of the children. The children also have sessions where there's a dedicated childcare worker who would work with them, and then in other sessions, they're part of the larger group. So briefly, this is what it looks like, and these are the various features of the program with at-home tasks, a buddy system. We have a manual that is about to be released shortly, very extensive manual that was piloted, tested, and looks very beautiful actually. So hopefully we will share that with you, and that could be a very useful tool for adaptation in different countries. The social workers run the groups, they train to do it, using the manual, they supervise, and then there's ongoing monitoring and fidelity checks. This is some of the core sessions of the programs. These are the 12 sessions, but there are 14 sessions, and they focus on different domains. So the domains are in child caregiver and family well-being is one of the dimensions. These are family relations, parenting, communication, behavior management, and so forth, discipline, conflict resolution. Then there is caregiver engagement in children's schooling. And since this is a preventive intervention, and we know that improved child caregiver involvement in children's education is been proved in various studies around the world to have positive impacts on children's well-being, we then included this particular component as well: nutrition, financial capabilities, social support, and the use of resources. It was then delivered in partnership with the City of Johannesburg and their social workers in these different regions of the city, and it's offered as a local government intervention. The City of Joburg employs about close to 70 social workers, and they deployed in these regions, and so we were trying to work with them and to leave this capability in the city. I'm going to skip much of the methodology because time is limited. But just to say that the study was a qualitative study, this component of it. It had a pre and a post test, and it also had a 9-month follow-up intervention. It had also a treatment and a control group, so it was a pretty rigorous design of how we then hope to draw conclusions about the changes that occurred as a result of the intervention. We have data for 131 families over a 12-month period, and we tracked 36 children over 3 data points separately to hear their views of the program, including 10 teachers who were part of the program. The profile of the families was at baseline, so that included both children, families who were in the treatment and the control group, and the findings are pretty similar to what was discussed previously. They were all CSG, of course, beneficiaries. Poverty was, of course, pervasive, poor quality community resources in the area. Zeni spoke about problems with transport. Here we had problems of sewage, problems of running water, and so on. There were significant strengths that families reported, and I think that is important that we build on those strengths as well as we found also, of course, challenges in parenting, especially in relation to discipline and in particular. So those are the 5 sort of key domains and that the whole program is structured around. And I'd like to move now to the findings, which is where I would like to maybe spend a little bit more time, because it is, I think that there's a lot of discussion about the importance of combining cash and care, but do we know if this makes a difference? And what are the effects and the effect sizes that we can expect? So this piece of work is obviously the foundation of helping us to think about whether there can be a randomized controlled trial with larger numbers of families in future, and then to make sure that we can then assess the changes over time. And that would be a more robust analysis. But this preliminary work is crucial if we were to go any further with an empirical piece of work on the impact of cash plus care. So the first finding was that in relation to child, caregiver and family relations was that we saw improvements in 3 main areas. There was a decrease in harsh parenting. We saw improved positive communication across all the waves, and that the caregivers perceive their parenting to have changed positively. They also used some of the techniques that were shared with them, such as rewarding good behavior, using rule setting, and this was sustained 9 months later. In relation to caregiver involvement in children's education, we saw that this was also sustained over time, and that the caregivers also applied the techniques and skills used, such as helping with homework, increased confidence of the caregiver to speak to teachers, for example, and also positive changes were noted in the child's response to school, such as enjoyment of school, better engagement in schoolwork, and perceived improvements in their subjects. The next domain is in their social and community connectedness. This is building their natural systems of social support that exists in the communities, and that this hopefully, if we could strengthen this, the hypothesis is that people would be able to rely on their own community systems of support instead of only depending on the social workers. So the value of the group experience was found to be extremely useful, and these were some of the points that they raised. They also mentioned keeping in contact with their buddy. They had a Sihlengimezi buddy that they worked with, was in their group. Some also improved their communication with the extended family, and we see all the kind of areas where those changes occurred, such as learning from others, experiencing love and care from group members, and building their support networks. In regard to their financial capabilities, we had a battery of questions, which we've used in other survey studies to assess impact of programs with youth, for example. And we see here that despite the small amounts of money, people were still saving, and that they were using their resources to help manage risks. There was also improvements in budgeting behavior, and interestingly, through the program, a distinction between their wants and their needs. In relation to nutrition, we found that there were some positive changes here, that the nutritional value was viewed as the value of nutrition and breakfast as the important meal of the day, that certainly improved. But what we did see, because we do comparisons with a control group, and here there seemed to be some, the data was not conclusive because there were changes in the control group. So while we saw some positive nutritional benefits, we thought that we should be cautious with this particular finding. The next one, which is pretty important, I think, was that we had a battery, a depression battery, the CSDR, which is also used extensively and is validated in South Africa, and it's used also in the National Income Dynamics Survey. And we saw that that depression reduced between baseline and endpoint, and you can see there the numbers, the improvement at endpoint, the green, the blue bar shows the improvement from the baseline, which was 47.5%. What we do see then 9 months later is that there's an increase in depressive symptoms of 3.5%. So after the end of the program, and maybe due to changing conditions, poverty, and lack of support through the intervention, we saw a slight increase in the number of people who reported depressive symptoms. But it's important also to note that the numbers were still lower than what they were. The depression improved compared to the baseline, even though there was a small increase. So it's not as the changes were then moderate, we would say at this stage, and that we also feel that here we would consider this to be inconclusive when we're comparing the treatment in the control group. And there was a very interesting finding here that in the control group, there were improvements actually in depression scores from what it was, although it wasn't at the same level as in the treatment group. And we see that in other South African surveys that Lucy Kluwer, for example, conducted. And there's some thoughts on why this might be. But because of this, we thought that we should also treat this result with some caution. Given the limited time, I'm not going to go through all the other slides, but just to say that the children, we saw very positive changes from noted by the children in the analysis of their drawings. And we have an excellent journal article also on this, and that the improvements were sustained, but there were certainly children with severe difficulties and challenges that needed to be addressed. So these are the positive stories we can see in the pictures, but of course these pictures of the children show some level of concern. Social workers also found, we did research with them and through the city of Joburg, and they found the program to be useful, the training to be useful, the design features and so on. They felt that there were some difficulties and challenges with recruitment. And of course, if their workloads were not reduced, then this was very difficult for them to run the program on top of everything else. Here are some of the positive feedbacks and very, very positive on the part of a lot of the social workers, but I don't have time to go through that. So in conclusion then, that we think that this program has potential for integration into social work services, into existing services. And we also think that it could promote and disrupt disadvantage or ill-being via increased agency, and could create new pathways to improve children's well-being. I'll leave you with some of these questions for DSD to think about, and for Maureen and her team. Now that there is a huge commitment to cash and care and the use of the real-time tracking tool, I think that we have a lot to learn because this is very complex implementation. And there's a lot to learn from how this can work and could be scaled up in practice from some of the work that we are currently doing and from the implementation that will arise from the real-time tool. Our family workbooks, as I mentioned earlier, those are available. We're also testing the program now with another group with more social workers and through our Communities of Practice program for system strengthening, which we started alongside the real-time tracking tool, a program that UNICEF and DSD is running. And we also learned a lot and used some of the ideas from the tool. And UNICEF was certainly part of this particular intervention and the learning that we are documenting now on the Communities of Practice program. We're also rolling this out with Shislengimezi in some of these 5 schools now. And we're also following up the families who have been identified to be at risk, high risk and at moderate risk. And we have 5 social workers engaged at the school over the next 3 months, and we'll document the learning from this. We also have funding for testing this through tips for families at a local, through community radio. But let me end here. Thank you.
Well, it was an incredible, important presentation with real-time findings from the pilot that was so ably carried out through your leadership with the various partners in Johannesburg. Would you mind to tell us in 1 more minute about the conference in July, please?
Thank you, Micah. The research center to which I'm attached, the Center for Social Development in Africa, is co-hosting an international conference, the 22nd Biennial International Consortium for Social Development Conference, which will be held the 13th to the 17th of July. And we would really love for UNICEF officers and staff and your partners in Africa to join us. It's an international conference, and we look forward to your participation. I will send the link to the conference site, Micah, and we look forward to collaborating with you. Thank you.
Great. Thank you so much. And beloved participants, sorry that we went over time. I was so enthusiastic about the wealth of learning from the different components of the cash and care model that I apologize for having gone over time. But Leila, if the family workbook could be made available to this group, that would be incredibly important. And I am looking at the chat where Emily has given us the link for the recording of this webinar, the PowerPoint presentations and the resources. So there's a lot of learning to be done. I am looking at Emily and Mona to allow for a brief question and answers before I hand it over to you, Mona, on the closure. As a lot of questions have been answered in the chat, but I think for urgent pending issues that people would like clarity on, maybe we open the floor for a few minutes and then over to you, Mona, for the closure. From my side, incredibly grateful to work with such a set of very important partners in South Africa, and for you to spread your wealth of wisdom with everybody in the region this morning. And I hope that all these different interventions really lead to the betterment of children, which we can see through the evidence that is being presented to you this morning that it really does. So wherever we can be of assistance to provide more information on the various models, we are happy to do so, and also to look at exchanges, etc. Thank you from my side. Please, Emily, Mona, a few minutes for questions and answers, and over to you, Mona. Thank you.
In terms of the questions and answers, I think that pretty much all of the questions that were raised have been responded to in the chat box, or the people that have asked them have had to leave a little bit early. So perhaps we could suggest instead that if people have further questions or queries around this model, that they can contact me or Mona, and we can consolidate those questions and see that they're answered. I think as we are quite a bit over time.
Okay, I think that's reasonable. We do encourage all the participants to ask the questions in the chat box, and also use the link so that we provide responses to all your questions. Now I'd like to do a quick closing remarks. First of all, I'd like to thank Dr. Mcgrathy of Social Security, DSD, and Ms. Zeni Tumbado of National Association of Child and Youth Care Workers, Dr. Rita Sonko of Strategic Analysis Management, and Professor Leila Patel of University of Johannesburg. Your presentations really were very much informative and very insightful. And it really helped us to understand and know the examples of cash plus care in South Africa. Special thanks to Emily of Child Frontiers for supporting the management of this platform. And of course to Micah for chairing this session. I hope all of you have enjoyed this webinar and have learned one or two new things on social protection and care. I understand a lot of you may have more questions or you want more time to have a discussion. We're actually organizing another session in autumn in which we can spend more time for you to ask questions and also to learn from Uganda, in which they will also showcase how they're linking their social protection and childcare reform program. We will share the recording of this webinar and the minutes, which will include the PowerPoint presentation. But I also see Emily has already provided the links in the chat box. And also, I'd like to remind all the participants to make use of the help desk that we have established. So we encourage government and country offices, UNICEF country offices in the region, to send any questions on care reform, and to also let us know if you would like to be connected with another UNICEF country office or another government in the region to share learning on care reform. Do let us know. I hope Emily has put down our email addresses, but if she hasn't, I'll also drop that in so that you can write to us and we will do the needful. We will share more details of upcoming webinar that will be on other examples on the use of social protection to strengthen families from across the region. So that will be shared by email. And with that, I thank you all very much for your active, attentive participation, and wish you a very good rest of the day. And goodbye for now.
Thank you so much, everyone. Thank you, Mona. Thank you, Emily.